production side of things. All right, good morning. Welcome to the Cook County Board of Public Health and Human Services on this Tuesday, January 17th at 8:32 a.m. I'd like to call this meeting to order. And the first item after that is the approval of the consent agenda, including our meeting agenda, which we need to amend here, as well as the minutes and the bills, contract, anything anyone would like to pull and discuss a little bit further?
Not me.
All right, then I would like to make the motion to amend that agenda to take our introduction to new staff till next month, and would entertain, or I'm sorry, I guess I'll just amend that. Do I need a motion to amend that? No. I'll look for a motion to approve the amended agenda.
So move.
Thank you, Commissioner Storley. Thank you, Rana. Any further discussion? Seeing none, all in favor?
Aye.
Opposed? Motion passes unanimously. Thank you. And then that scoots us way down to the election of the 2023 Public Health and Human Services Chair and Vice Chair. And Commissioner Sullivan, hey, welcome.
Hey.
We just started, so I'll give you a moment. Well, we're at the election of the chair and vice chair, so might want the entire board for that part. But we can talk in the meanwhile.
Well, we could clarify that weather issues prevented Commissioner Sullivan from
Just
being here on
let the
time,
record
so.
note that it was the weather.
It's an excused party.
But I am very willing to serve as chair again. If anyone else has any interest in serving as chair, I'm also very open to that. So does anyone else have interest in serving as chair? Okay.
All right.
Does anyone have any interest in serving as vice chair?
I'd be happy to serve as vice chair.
Very good. Any other interests in vice chair? Doesn't look like it. Well, there we have our slate. Would anyone like to put that into a motion?
I would place a motion that we make Commissioner, I think of
Mills?
Dave Mills. I'm sorry, I don't think of Dave. Commissioner Mills as
It's the
chair.
weather.
Yeah, maybe, probably. And Commissioner Sullivan as vice chair for this committee.
Thank you, Pat. We have a motion. Is there support?
Support.
Thank you, Commissioner Hawkins. We have a motion and support. Any further discussion? Hearing or seeing none. All in favor? Aye. Opposed? Motion passes unanimously. Thank you all for your support and confidence there.
Thank you
And
both for
thank you for
doing
your
that work.
willingness
Absolutely.
there. Don't talk about eggs in one basket here. That moves us down to our director's report. Alison, good morning.
Good morning. Ooh, good morning, Public Health and Human Services board members and staff, and anyone who's listening in to the live stream this morning. This is my 5th presentation to this board, summarizing our year as a department, so very humbled and grateful to be here this morning and to share about our work as a department in 2022. I will take a similar format as previous years. We'll start with a discussion of staffing changes, new programs and services, give a high-level caseload data report for each of our primary divisions or units. We'll give an update on our outreach and engagement work as a department, and then I'll also fold in my regular monthly director's report in at the end.
We're setting up the monitors yet, FYI. That's what all the beeping is.
I'll wait till everyone gets settled in with their visuals here.
Sorry for the disruption.
No worries.
It's the weather.
So if there's one word that describes 2022, it's turnover. Turnover was a driving factor in the Public Health and Human Services Department in 2022. We had 12 positions turnover, which represents nearly 40% of our team. These staff retired, left for other positions, either within or outside the county system. These staff who left our team in 2022 left with a combined 54 years of service just to our department. This isn't over the course of their careers. This is within Cook County Public Health and Human Services. So we had several staff with 5, 7, 8 years of experience. So the impact on our team and the people we serve was profound when these staff left. Particularly on staff and supervisors who work to ensure continuity of service by taking on additional on-call shifts or cross-training in on new programs and dedicating time and resources to onboarding new staff. Turnover is costly, and it creates a ripple effect on our team and the people we serve. This is an all-time high level of turnover for our department. In 2021, 8 positions turned over. In 2020, just 1 position. Prior to that, an average is around 4 positions each year, so a significant increase. I just want to give a note on the data. At my year-end presentation last year, I reported 7 positions turned over. I've since updated that to 8. I'm now including internal transfers and promotions as a part of that turnover report. Even though that individual is still within the department, it still creates another vacancy within our team that needs to be filled. All right. We welcomed 12 new staff in 2022 to backfill these positions or in new or reconfigured positions developed in response to emergent community needs. The newly created or reconfigured positions in 2022 include the statewide health improvement partnership grant-funded public health educator position. Historically, this was contracted to the Sawtooth Mountain Clinic, but we brought this in-house in 2022 when that position turned over at Sawtooth. That position's co-located at the Cook County Community Center, and Christina Matson joined us in that part-time role in July of last year. Also new in 2022 was the reconfigured licensing case manager and addition of child care coordination functions to that position, which increases our capacity to support the child care system locally. Nancy Deming came on board in that role in November. All other addition of staff hours and services were in our behavioral health team, which is where a lot of our growth has taken place as a department over the last 5 years following the closure of the Human Development Center's Grand Marais office. Additional hours included a community mental health and skills worker. We first added that position to our team in 2020 following the closure of the Human Development Center. We filled that vacancy in 2021 with a children's mental health focused position, providing both case management and therapeutic skills service, and that was in response to increased need and increased referral in children's mental health. We had a planned addition to refill that skills position in 2022, and we brought Abby Benusa on board mid-year in that role. In late 2022, we hired Matthew Baxley in an innovative new role with our team, working across systems to develop and coordinate a daytime crisis response system. Again, another significant gap following the loss of HDC. Finally, at year end, a clinical supervisor and behavioral health team supervisor came on board to oversee the growing team and add internal capacity for clinical services that are currently contracted out, and to pursue certification for services that we've added over the years following the loss of other services. John Speaker recently started in this role. In 2022, Public Health and Human Services staff led and supported program and service development in several key areas, all aligned with our 5-year community health assessment and health improvement plan. The Rural Communities Opioid Response Program is a 3-year federally funded grant partnership between the University of Minnesota, Grand Portage, Sawtooth Mountain Clinic, and Cook County Through this grant program, staff in our department are increasing our work alongside these partners, local schools, and other service providers to expand access to substance use disorder treatment, prevention, and recovery services. In late 2022, we also hired a coordinated mental health crisis response worker to partner with law enforcement, hospital, tribal, and county human services staff in both responding to and preventing mental health crisis calls during daytime hours. This is a 2-year pilot funded through the American Rescue Plan and regional mental health crisis grants. Throughout 2022, staff participated in the Rural Child Care Innovation Program to look at child care needs locally and engage with partners across a broad range of areas to better understand and address the child care crisis locally. In August, the Public Health and Human Services Board approved one-time funding to support a child care wage enhancement program to support existing child care providers and expand access to child care throughout the county. A reconfigured licensor and child care coordinator position within our department increases our capacity to support the various child care initiatives and to seek out and administer grant funding to support child care. The Child Care Solutions Subcommittee of the Public Health and Human Services Advisory Council meets monthly to keep members of the public informed and to continue to get input and explore avenues for ongoing support of child care providers and families with young children in care. Also launched in 2022, the Healthy Housing Program connects trained public health staff with homeowners, renters, landlords, and others through evidence-based healthy housing assessments. The goal is to identify housing-based health threats and provide grant funding to provide education and resources and help mitigate some of the health housing hazards. The Healthy Housing Network is another newly formed group that was established to engage multiple perspectives and advise the department as we continue to build capacity to address the link between housing and health. All right, and here's the data. Across nearly all program areas, our human services staff provided services to more individuals and families than in recent years. The Economic Assistance Unit worked with approximately 200 households receiving cash and/or nutrition assistance in 2022. This is up from 173 households in 2021. During this time, 733 households were enrolled in medical assistance or a Medicare savings program. This is up from 680 in 2021. Approximately 1,300 individual residents are enrolled in a Minnesota healthcare program that includes medical assistance or a Medicare savings program. This is up from 1,223 in 2022 across those same program areas. So this represents just under 20% of our population locally is enrolled in a healthcare program through the state that's administered by our team here in Cook County. Our social work staff responded to 455 intakes across all social services programs in 2022. An intake is a request for service that could be in the form of a phone call, a walk-in request, a report of a suspected maltreatment, or a referral from another service provider. Again, this is up from 429 in 2021. Next, I'll give a breakdown of total work groups or cases within each human services unit. But before I do that, I'll explain briefly what a work group is. This is a case. It could be a one individual receiving services. It could be a family unit receiving services. As the name suggests, a work group involves many other people providing and coordinating services beyond that individual or family being served. For example, one adult mental health work group might include the individual receiving services, but the work of our staff also involves coordination with others. It could be a therapist, a physician, a treatment facility, court systems, probation, other human services staff within our department, or within other jurisdictions, for example, tribal government or state government, and family members. So in 2022, the Adult and Home and Community-Based Services Unit, which includes general adult services, adult protection, assessment, care coordination, developmental disability, and waiver case management, that team provided support to over 291 residents and their families, and this also includes residents who live in facilities outside the county who require a higher level of care than is available locally. So that figure is up from 272 in 2021. The Children and Family Services Unit, which includes child welfare, child protection investigation, licensing of family child care and foster care providers, and the Parent Support Outreach Program, which provides supports to families to maintain stability and prevent out-of-home placement. This team supported over 88 individuals and families in 2022, and this is down from 107 in 2021. The newly reconfigured behavioral health team, which includes adult mental health, children's mental health, substance use disorder and co-occurring disorders case management, and some of the community mental health work I described earlier that we've begun adding within our team in recent years. That team supported over 157 individuals and families in 2022, and this is down slightly from 161 in 2021. So what does all this mean? This is a notable increase again in households enrolled in economic assistance and healthcare programs. This is a combination of factors, including program waivers that have been in place at a federal and state level to maintain and prevent disruption of healthcare coverage during the pandemic. We also continue outreach to ensure that people are aware that these benefits are available. This is not a significant change in the number of intakes or work groups across other human services programs. Again, these are provided just as a snapshot and don't tell the full story of our work as a department. Within public health, in late 2022, our staff began conducting healthy housing assessments. In the final months of the year, 9 assessments were initiated for Cook County residents. However, COVID response continued to dominate our work as a department in 2022, particularly in the first half of the year. The year began with the Omicron wave impacting Cook County and the region. At the January Public Health and Human Services Board meeting last year, we reported that COVID cases had doubled in the last month, with 607 confirmed cases, up from around 300 the month before. Between January and year-end 2022, over 1,000 positive COVID-19 cases were reported to our public health team. And just a note that case totals reported by Cook County Public Health and Human Services on our hub site each week include over-the-counter antigen tests that aren't reported to the state. So these are positives that are reported locally, either to our team or to Grand Portage Health Services, rather. So there is an ongoing discrepancy between local and state data. Furthermore, not all over-the-counter positives are reported to our team, so it's likely an undercount of the actual cases in the community. Throughout 2022, staff continued coordination and promotion of vaccine events in partnership with the Sawtooth Mountain Clinic and Grand Portage Health Services. At year-end in 2021, 84% of the county had received at least one dose, with 80% of the county having completed the vaccine series. Late in the year, eligibility for booster vaccines were expanded to almost all adults age 18 or older, so that was a big ramp up for our team to meet that demand. Throughout 2022, staff continued to coordinate and promote these events, including bringing in Minnesota Department of Health staff to run vaccine events throughout the county on evenings and weekends to better meet demand. By year end 2022, our youngest county residents were newly eligible for the more protective bivalent booster vaccines. Our team continued to conduct regular outreach through the creation and sharing of high-quality content on social media in 2022. We continue to grow our reach with these pages with 91 new followers on Facebook last year and 51 new Instagram followers. Each month, staff present to this board on program areas and contribute to Cook County News Herald articles and WTIP interviews to reach more people and provide information on services. Public health COVID response outreach continued throughout 2022 in collaboration with partner agencies. This included weekly COVID-19 hub site updates, WTIP interviews, media releases, and direct mail campaigns. The local Mental Health Advisory Council continued as a partner for our team in mental health outreach. Some of the initiatives that we worked on included promotion of the new 988 suicide prevention hotline, updating our local mental health resource guide to reflect that new shortened dialing code, and promotion of resources on Boreal. New in 2022 is that we had 3 staff from our behavioral health team, Abby Benusa, Anna Ross, and Melissa Becerras, facilitating community support groups at year-end at the hub. The group led by Abby focused on developing safe connections post-COVID, and the group led by Anna as a part of her Master of Social Work internship with support from Melissa focused on grief and loss. The Public Health and Human Services Advisory Council and Local Mental Health Advisory Council were both active in 2022, making policy, service, and funding recommendations, supporting outreach initiatives, and fostering connections across providers and service organizations. Both advisory councils welcomed new members last year. The Public Health and Human Services Advisory Council remained engaged with the Community Health Improvement Plan activities, and a subcommittee reviewed applications from community nonprofits for public health grant funds in the amount of $191,000 for budget year 2023. I did not prepare year-end reports for either of these councils, as I typically do. I didn't realize it until I was working on this presentation and didn't have those to reference. So I'm looking for feedback both from this board and from each of those individual advisory councils. If that continues to be a helpful exercise, I'm happy to dedicate the time to make that happen and bring back those reports in February and March when those groups meet again. All right. So when I gave this presentation last year in January, some of the goals and initiatives for 2022 included COVID response and recovery, behavioral health services, staff recruitment and retention, housing and childcare, and our community health improvement plan and health assessment. All of these continue to be priorities for the current year and year ahead, in areas where we've prioritized our work as a department over the last year. Staff recruitment and retention is moved to the top of the list. That is the most critical issue facing our department and our ability to achieve our mandates and our mission. I do feel that the department and county have made meaningful steps towards addressing workforce challenges in 2022 with the adoption of a new, more competitive wage scale, and with the county taking a leadership role in investing resources in childcare and housing as critical needs for a strong, vibrant workforce and community. Internally, within the department, practices like stay interviews with staff, which is a structured questionnaire similar to an exit interview, but before someone is choosing to leave the department, offers a format for talking about how to improve work challenges. And it's a more two-way conversation that allows the supervisor to receive feedback and have some plan and accountability and communication around what they can do to improve work for staff. Next, I have a key issue and initiative within each program area. Again, there's so much that I could talk about, but wanted to identify one key initiative for the year ahead for each of our teams. Within Adult Services, the Min Choices revision launch is on track to start in March of this year. Min Choices is a system that counties, tribal nations, and managed care organizations use for assessment and support planning for all people who seek access to Minnesota's long-term services and supports. So what this means is a lot of meetings with DHS and internally, trainings and testing to prepare for this new system. Within our behavioral health team, the coordinated response pilot is a key priority. Right now, we're in the process of sharing findings and recommendations from Matthew's first 3 months on the job of gathering information on our current response system, looking at what some of the gaps are between our expectations and the reality of how those resources are accessed both in the daytime and after hours, by interviewing local and regional responders. As I said earlier, John Speaker is onboarding into the new supervisor role. Really excited about the increased capacity that this brings to our team to assess our capacity and needs and determine viability for pursuing certification to bill for some of the services that we've been providing. Continued collaboration with local and regional peers is key here, as we cannot fill all the gaps alone. These are national and statewide gaps and systemic issues that we need everyone's assistance and participation to fill, and excited to see that continue into next year. Within Children and Family Services, continued focus on prevention and early intervention. Our new licensor and child care coordinator position is a key piece in that. The development of our wage enhancement program pilot for providers, and management of additional grant funds to strengthen and expand availability of child care throughout the county and Grand Portage. Within our economic assistance and healthcare team, the waivers that were put in place during the pandemic, during the early years of the pandemic to maintain healthcare eligibility, are expected to be lifted in 2023. The State Department of Human Services is expecting the unwinding of these healthcare renewals to be the most significant volume of work ever for Minnesota healthcare programs, with 1.4 million renewals statewide. We are already working to conduct outreach, to connect with residents who may have had an address change over the last few years while those waivers were in place, to ensure that they update their address to avoid losing coverage. At this point, the Department of Human Services is seeking approval from the Federal Centers for Medicaid and Medicare Services for unwinding those waivers. So we don't yet have a date, but anticipate that will be sometime in 2023. Within public health, work continues on our community health improvement and health assessment, with the 5-year cycle starting off in 2023. In 2022, staff reviewed new data sets and conducted focus group interviews with key informants within each of our 5 priority health areas. We anticipate bringing partners together in early 2023 for an in-person and hybrid meeting to review information and next steps. That's all I have for my year in review presentation, but I can move right into staff and agency updates for 2023 and then address any questions from the board. Some of this is a repeat. We had 2 new staff join the team last month. Social Services Case Aide Ariel Charlier started on January 9th, and Behavioral Health Supervisor John Speaker had his first week on site last week. John is working remote this week, but expect that he'll be here in February along with Ariel for an introduction to the board. We are in the process of filling the Adult Services Care Coordinator position and anticipate having a hire recommendation for the next regular Board of Commissioners meeting on the 24th. Continuing to recruit for our Family Services Case Manager position. This is one that has now been vacant for over 6 months. I want to recognize the work of our Children and Family Services Supervisor, Grace Bouchard, and Family Services Case Manager, Stacy Schmidt, for their incredible work in maintaining continuity of services while very under-resourced as a team. Our recently vacated mental health worker position with Abby's transfer over to Children's Mental Health is posted and open for recruitment through the end of the week. And we hope to get a list of referred candidates early next week. Also want to let this board know that we are in the process of exiting the Merit System. Merit System is a Department of Human Services system that some counties throughout the state participate in to receive shared services and support for regulatory aspects of human resources. In recent years, more and more counties are electing to exit the Merit System as it's no longer a value add for their team, and that's certainly the case for us here, where Merit System seems to increasingly add more barriers to receiving qualified candidates referred to our department. It's challenging for applicants to navigate multiple systems to apply for a position, and I'm in contact with our HR director, Leah Ekstrom, to determine what we would need to build internally in terms of infrastructure to take that on within our department and no longer work with the Merit System. Agency updates. The Department of Employment and Economic Development, or DEED, awarded funding to Cook County Child Care Initiatives. This is a joint application between the Public Health and Human Services Department and Economic Development Authority. Our staff met with the Economic Development Authority Executive Director, Beth Drost, to get direction from her and her board on how to move forward, knowing that she's in the process of moving on to another position. And we will be taking on administration of that grant within the Public Health and Human Services Department, just to maintain progress with that during leadership transitions at the EDA. We also secured additional funding through a First Children's Finance grant and anticipate that a media release will go out this week with information on all of the various child care initiatives in the county and newly secured funding to support them. Our economic assistance and healthcare team is experiencing a high volume of new applications in the new year. We have received 23 applications through Friday, January 13th, last Friday, primarily for food support. This is significant compared to December 2022, where we had 25 total applications received in a month. And at this time last year, when we received 26 total applications. So if we're on pace to double the volume of applications that we receive in a month. Multiple staff were involved in pre-planning and responding to emergency shelter needs during the holiday storm. Staff participated in an after-action review led by Mike Keyport, and I just want to thank and recognize the staff both within our team and other county departments who responded during those events over the holidays. Finally, I am working on the 2023 Public Health and Human Services Board presentation calendar. Next month, Greg Barnier with the Wilderness Outpatient Treatment Program and staff who support that population and service will be here to present, which is why I didn't include a lot of information on outpatient treatment today. We have some standing updates that staff provide each year, including our annual budget report and financial report. But I'm interested in feedback from this group on what program areas you would like more information on in the next year. I know we have a new commissioner on board, Commissioner White. It was a pleasure to meet with you late last week and start the onboarding process. I think I got about a quarter of the way through the information I'd prepared to share, but there's a lot, and I think your fellow commissioners will support you in that, and I'm happy to be a support as well as you learn about public health and human services programs and the wide variety of services that you'll support in your role. So I'm happy to take any questions about my year-end review or January staff and agency updates.
Thank you, Allison. Any questions or comments?
I have a
Commissioner White, please.
question. Way back when, you were talking about, I forgot how you termed it, but substandard housing. I mean, do we have a lot of substandard housing here, or is it based on discord within the households that you're investigating? I mean, or do we really have people living in homes that don't have proper heating or whatever the case may be?
Yes, we do have people who are, because of the overall lack of available housing and particularly affordable housing, are living in conditions that are unsafe. That has informed our approach to applying for this healthy housing assessment program, is that it's a way for us to apply evidence-based resources and financial resources to addressing some of those home-related health hazards.
So is this like a homeless situation?
No, not necessarily. The Healthy Housing Program is looking at people who are currently housed but have potential health risks in their home.
Oh.
That isn't to say that homelessness doesn't exist in Cook County. It absolutely does. It just looks different than it does in other communities that have more formal resources for people experiencing homelessness, like shelters.
Thank you, Commissioner White. And yes,
I
Anna.
just want to thank you for all your hard work. It's just amazing to hear how many things have been done in a year by not very many people. So, thank you.
Thank you, Rana. I appreciate that. And it's very rewarding for me to kind of be forced to take the time to pause and reflect and realize what all has been accomplished over the course of a really challenging year. So thank you.
Thank you, Rana. Commissioner Hawkins.
Yeah, I'm wondering about the 23 applications for food support that you received in the last couple of weeks. Are these, I actually wrote down here, what are the age of these applications? Are they new or have they previously applied? And are they homeowners or renters?
Good questions, Commissioner Hawkins. I don't have access to any of that information, but I'd be happy to follow up on that. I just have a rolled up summary of all of the applications by program area by month.
Thank you.
Absolutely.
To apply, though, they must be older than 18, right? Or do kids apply?
I believe, yes, you need to be 18 or older to apply. There might be special circumstances.
I wrote down age, meaning are they working age, are they senior citizen age? I'm just wondering where we are finding the need and how that compares to before.
Yes, that would be very valuable. I'd be happy to follow up with that.
Thank you.
Thank you, Commissioner Hawkins. Commissioner Storley.
Thank you. Thanks for your report, and I enjoy your county connections in the paper, too.
Thank you.
That was a good review. It didn't go into a lot of minutia, but it gave a good overview of what happened in '22. I have a question. If you have had any experience with the Minnesota Department of Health, headlines in the paper yesterday was they're having their own mental situations. Have you had any inkling of that, or have you had any kind of not getting to the point with grants or money?
Yes, thank you for your question, Commissioner Storley. I saw that same article, and yes, that is consistent with our experience here locally, where we have had delays in the funding amount for our regional crisis grants and other grants that support our work.
So I
Some
guess
of those came in late last year, or we have yet to receive finalized contracts. A lot of that grant and contract management of our regional crisis grants happens at a regional level through our joint powers, Arrowhead Health Alliance, which Commissioner Mills serves on, as well as our regional Arrowhead Behavioral Health Initiative. So there's been a lot of discussion and advocacy within those groups for ensuring improved communication with the Department of Human Services.
Is there anything we can do as commissioners to support them, but say, you know, we can't dilly-dally here with funds and grants and all that?
I can think more about that, Commissioner Storley. That's certainly a personal goal for me moving into 2023 is to improve my engagement on a regional and statewide level with some of these critical issues that are so important to our work locally. That's something that has been harder to prioritize in recent years, but is so critically important for my role in our department.
Right, thank you.
Thank you.
Thank you, Commissioner Sterling. That reminds me, yeah, and just your response to Allison about workload and turnover and the impacts that has on our leadership. It's harder for us to do those bigger picture, bigger goal things when we're, you know, putting out fires and all that. So, yeah, it's been a very difficult last couple of years with transition and pandemics and
Weather.
and weather. Touche. And yeah, and staffing. It's just demographics straight up. And yeah, I did report, I think it was last month, on that AHA funding, and DHS is breaking it up into, I forget how many different applications or grants instead of one, so it almost, I think, quadrupled their workload or something, and so that seems frustrating, but I'm happy to hear that it's being talked about. That's important. Any other questions? Commissioner Sullivan?
Just to kind of spin off what Commissioner Storley was speaking about, Alison, keep us in the loop for how we can support you when we go to the legislature. We're going in February, February 21st. And anyway, we as a group of commissioners and also thoughts on how AMC can support the needs that you have in terms of getting those grants and funding from DHS.
Thank you, Commissioner Sullivan.
Anybody else? Anything else?
I have a very brief COVID-19 update
Okay.
received from our public health supervisor. Just want to share that we did see a slight uptick in weekly COVID cases following the holidays, with 15 to 20 cases for the past 2 weeks. Our community level remains at medium. And I did mention this, but we'll just reinforce that Sawtooth Mountain Clinic began offering the updated bivalent boosters to the youngest eligible group, and that's age 6 months to 4 years. And community members can call the Sawtooth Mountain Clinic to request an appointment. Thank you for letting me.
Mr. Chair.
Yes, Mr. York.
If I could, I'd just like to publicly thank Alison and her staff for the great work they do every day. It has been a tremendously difficult year with all the staff departures, and trying to keep programs up and running when you're dealing with that kind of turnover is really, really difficult. And there have been some really low points throughout the year when we've received, a couple of notices of people leaving within a very short amount of time. It's hard to kind of put one foot in front of the other when you're dealing with those circumstances, but you guys have been doing a really great job, and I'm really grateful for the work that you do, and it has a real impact on the community, so thank you for that.
Thank you, Administrator Yorkie.
Yeah, I would echo that and all as well. I was going to ask about that largest workload ever. How do you anticipate that affecting our organization and your department?
I think we're better positioned than many other counties due to our size. We don't have thousands or hundreds of thousands of renewals to process like some of our peer counties in the region or state will. in the process of hiring new staff, anticipating the large volume of work mid-year. We are cross-trained across our staff in healthcare programs, which is a strength. It's not, you might remember, in November you heard Alison Plummer present on long-term care services. Most of our volume of healthcare cases is in the Minnesota Eligibility Technology System, or METS platform, that MinSure exchange, primarily families and adults. So as it relates to those renewals, I think we're in a good place to respond and process those. A lot of it is dependent on the direction we get from the state in terms of how to prioritize and move through, what system barriers might we come across in terms of entering and processing those renewals. I'm hopeful that our outreach today to get updated address information will help ensure coverage for individuals who have had changes over the last few years, but it's hard to say.
Yeah. Well, yeah, I'm happy to hear that we're pretty well positioned, and that makes sense from what you're saying too about cross-training as much as we can. And probably a lot of the challenges, like you said, also are just going to come from the state, and the sheer volume that they have to process is going to affect services potentially for Cook County. But maybe, so we're maybe not the bottleneck just because we're a smaller county and wouldn't have that overwhelming, but it's still going to be a larger workload for us too.
Yes, and I would add not just for economic assistance and healthcare team, but many others within our department, including our front office staff who are receiving the incoming documents and paperwork, scanning those into our electronic document system, and our social work staff who are working with individuals and families to ensure that there's no gap in coverage so that they can continue to access services, be them mental health, substance use disorder treatment services. So that continuity of healthcare coverage is critically important at a variety of levels within our team and the people we serve.
Yeah, it's interesting. So I think there was a pretty statewide, pretty significant hiring for COVID response. And I don't know where those staffing levels are out now statewide. And now, on top of that, there's going to be this hiring at the state level for processing the application. So, and we have a workforce shortage statewide. So it's quite the situation that we're going to be in here. And I just really appreciate the difficult work that you have to do and having to navigate that. Just please keep us in the loop and how we can best serve you, the department, and our community. So, per usual, right? Thank you. All right, we'll move on to item 6 here, items for board action. We have a grant for Adult Protective Services, and this is the contract here. You want to talk about that, Alison?
Sure, happy to. So I put this under items for board action rather than the consent agenda, as it is a new grant. This grant funds are a part of the state's Coronavirus Response and Relief Supplemental Appropriations Act, or CRSA. So the state received over $300,000 they received a much larger appropriation than that and had a competitive grant process, after which over $300,000 remained. This funding was balanced to counties based on the number of reports of alleged maltreatment of vulnerable adults that were accepted for investigation in 2021. Counties had the choice to opt out of this funding and were required to submit a letter of assurance and a brief spending plan to the Department of Human Services to indicate how the funding would be used. Our spending plan, which was approved by the Department of Human Services, targets these funds to address one of our most commonly reported but difficult to resolve issues impacting vulnerable adults locally, and that is self-neglect concerns associated with hoarding behaviors. These funds will allow our staff to assist adults referred through Adult Protective Services with temporary lodging and other expenses, including refuse removal, pest control, and cleanup and sanitation services to allow adults to return safely to their home environment. We received $721. Within our team, Martina Johnson, the Adult and Home and Community-Based Services Supervisor, will monitor and approve spending. And this contract is through November last year through September of this year.
Thank you. Any questions for Alison? Commissioner Hawkins?
Why would any county want to opt out? Why?
That's a
Reporting?
great question. It is a balance in determining what is cost effective for counties to accept in terms of some of these really small grant awards.
That's what I was thinking.
So $700, if you think about, the work that goes into developing the contract, the budget, the spending plan, managing that grant contract, reporting it to the state.
So we've spent it already.
Pretty much, yeah.
What can you do with that?
In different ways, but this,
Yeah.
we're allowed now to target this towards needs in our community where there is no funding
Sure.
funding source.
Yeah, it's better than nothing.
It's better than nothing, but it is always
Almost
a
nothing,
balance to determine what's cost effective for our team to seek out funds. And we've done some of this on a regional level with the grants that we receive from the Minnesota Department of Health through the Community of Health Board. In recent years, we've initiated funding trades with large counties like St. Louis County that have higher volume, higher caseload, more capacity internally to report and manage grants. So we, for the last several years, have had an agreement in place to trade some of our TANF dollars, that's Temporary Assistance for Needy Families, funding that supports home visiting programs throughout the region. We've traded our TANF dollars to St. Louis County for an exchange of an equal amount of local public health dollars because those are more flexible. We still have to do some reporting, but the level of reporting is not as significant.
So the state's messing us up. Just want to be clear of it. The state
Bottom
needs
line.
to, yeah. Rethink the way they do things. Okay.
Yes,
Thank
there's
you.
a lot of fragmentation across public health and human services in terms of the minimal grant funds allocated to support really significant needs.
And Mr. Chair, if I could add, that's a real issue, the administrative and reporting burden. I once oversaw an EPA grant of like $20,000, and by the end of it, I wish we'd never gotten the grant because it just ended up taking so much time to
Right.
administer and report on. So that's a real thing.
Yeah. This is a little bit, it's different, of course, but I think about the Healthy Homes assessment and like, there's something, right? What was it, the max $700 per individual or home or something like that, but it's such a small dollar amount for probably what the needs are. But it is something, and it is illustrating that need and kind of demonstrating ways for a process. And so I'm proud that we're a part of it, but it is frustrating, like Commissioner Hawkins alluded to, that we're just jumping through hoops here. But it is, yeah, a very significant need in our county, in our community, so. All right, I'm entertaining a motion here. If there's no further questions.
Mr. Chair,
Commissioner Sullivan?
I'd entertain a motion to approve the Adults Protective Services grant contract.
Thank you, Commissioner Sullivan. We have a motion. Is there support?
I'll second.
Thank you, Pat. I have a motion and support. Any further discussion? Hearing or seeing none, all in favor?
Aye.
Aye. Opposed? Motion passes unanimously.
Mr. Chair?
Thank you. Yes, Commissioner Starley?
Yes, before we move on to our committee reports, not that I want you to have extra work here, but in response to Commissioner Stacy's question about the numbers for the food access, maybe because you asked us, would there be any particular department that we'd be interested in your reporting? And with Commissioner White being new, could you just list all of the different areas that we would consider then for our next meeting? And that would be helpful to you too, I think. Would that be a lot of extra work?
Not at all. In
Okay.
fact, as I was preparing to meet with Commissioner White last week, I referenced a presentation that I gave to this board in February of last year with a department overview as we had a new commissioner coming on board. So I would be happy. I already shared with Commissioner White that I'd be updating that to reflect new programs and staff. So I'd be happy to share that with the full board.
Great, thank you.
Absolutely.
Thank you, Commissioner
Good
Starley.
review.
Good idea. All right, well then, we'll move on to our committee reports, starting with the Active Living Steering Committee. I'm sorry, did I see, no, I didn't see a hand. So at this point, we just kind of go through our committee reports. If you didn't meet, then you didn't meet. Yeah, pretty informal, but trying to keep the whole board kind of up to date with what's going on.
Okay.
So do you have anything to report?
I have nothing to report.
Okay, thank you. And we'll move on to AEOA. I don't think I have anything to report. We're going through strategic planning with AEOA. If anyone here has any input on focus areas that they would like to see more of with AEOA services, or any constructive feedback regarding AEOA services, it'd be helpful for me to hear that and gather that, and I can, compile that and include it with the strategic planning, maybe not verbatim, but just kind of the ideas and how it fits into the strategic planning. So AHA, nothing to report this month. I still haven't heard, as Allison said, anything about the DHS grant funding, so I'm kind of anxious about that. Moving on to Arrowhead Regional Corrections Facility. Commissioner Hawkins.
We have our meeting on Friday. I did participate last week in a job evaluation of Wally, the director, and with 2 other commissioners, so we'll be, everything went good. We gave him passing marks, so just a heads up. But we have our joint meeting with the Advisory Council and the ARC Board on Friday.
Thank you. Child Care Solutions Subcommittee, Commissioner Storley.
Thank you. Yes, we had our New Year meeting a week ago or so, and Commissioner Mills joined us. Child Care Solutions Subcommittee. Lots of good discussion and moving forward with at least sorting out, the program is going to look at the wages for child care, capping off at 40 hours a week, and compensation for people coming into the program. I think I was left with a really good summary from Bill Hansen, who really wants us to sustain our money in the future. And sometimes when you get a grant, that runs out, and then you have to, before it runs out, you have to say, okay, are we going to get more money? And then I did ask Grace to perhaps put together some guidelines for us when we go down to the legislature to tell our story, because we're beginning. And I think we want to impress the legislators to say, we've been talking about this for a long time, and now we have Plan A, B, and C, so that we are moving forward and and working with a great group of people. So did you have a takeaway on that, Commissioner Mills, other than that?
Yeah, the how the funding work was discussed a fair amount, and there was discussion about legal non-licensed providers. And that is, under state law, anyone can watch the children of one other household. And so there was discussion about whether or not the public health childcare grant dollars would apply to them. I was pretty skeptical about that because I want this program to show success, to have an impact, and to give best bang for your buck. So I felt like that one family is pretty restrictive, but after further discussion and, just the way I think, rolling it around and stuff, realizing how significant of a crisis this is in Cook County and how great the need is, it's just kind of like all hands on deck. Whatever is going to get more people back in the workforce, more kids getting the childcare that they need would be beneficial. So not sure where that conversation's going to go, but it was good for me to, I don't know, just, I'm happy I was there. I'm certainly happy you're there. Thank you for serving on that. But it was just got me thinking, so that was another takeaway, I guess.
And I'd like to add one other thing. One of the things that was discussed is the very important need for a substitute pool here. And this group is really looking to establish that pool of people, so when someone is sick, the daycare doesn't have to close down. I just want to put in a plug for that program. It doesn't have to be someone who is going to work every single day of the week. If we have a list of 15 or 20 people who can work, you might only get called once a month or might not get called every 6 weeks. So anyone out there who really would like to help, loves children and would like to help this effort, that sub-pool is a great spot to volunteer for.
Thank you, yes. That was all, I guess, from me. Is that all from you too? Yeah, okay.
For now, yeah.
Moving on to the Community Health Board. I can't remember if I reported on this last month or not, but we had our annual meeting, and what I always enjoy the most is just about the doctor's presentation, and this one was on sleep and sleep cycles and daylight savings and the impacts thereof, and so learned a good amount about sleep cycles and what's needed, where the most rest happens, and how the different types of rest happens, and different numbers of cycles and all that kind of stuff. So it's pretty interesting, especially for us up here in the northern climate where daylight is shorter. And otherwise, I guess just meeting in person for the first time in quite a long time. It was really nice for the Community Health Board and to meet new staff that we got through that program through MDH. Moving on to the Mental Health Advisory Council. Anything to report there, Commissioner White?
She wasn't able to attend, so.
Oh, I'm sorry, yeah, you're not.
Okay. Still doing
Brandon, thank you.
orientation. So we talked about a Narcan workshop, and a lot of people attended that. It was for the public as well as, professional people, and that's, what rescues people who have overdoses, and so it's really helpful up here, especially where people are kind of few and far between, to have more people trained for that, and I think that was successful. 20 people came. And then we talked about many of the things that Alison already talked about today, but we have a new children's mental health case manager, right? Abby. And let's see. The substance abuse grants for rural community opioid response, again, important for us here. And then there's also mental health first aid training, which is being done by some people. There's also mental health first aid for youth. And so those things are working, and we would, so at some point, we're going to work with, have some of the school staff come to our meeting to talk about some of these things, or to coordinate with them on things, if we could be helpful for them. But, of course, they're pretty busy with their daily jobs, so that makes it a little hard. But I think it was a lot of good information we did also talk about this healthy housing a little bit, and hoarding and things like that, which is a very difficult problem in the community, so. Did I forget anything? Is that?
We welcomed a new member, Leslie Olson,
Oh, yes.
who
Yes.
is a children's mental health worker with Grand Portage Human Services.
Oh,
Leslie
yes.
wasn't able to join us last week, perhaps due to a Zoom link error on our part, but excited to bring Leslie on board in that council.
And we also met John Speaker on Zoom, so we got
Yes.
to see him, and it was just like his first day of work, I think, but it was.
Second day.
It was very happy to know he's there and ready to work, so that was exciting.
Great. Thank you. Restorative Justice, Commissioner Hawkins.
Well, we meet tomorrow.
Okay, thank you. Council on Aging, anything to report there, Commissioner?
Like I had said last time, it's a really exciting group of people. I had no idea, excuse me, the energy that's there in that group. And it really is working on making growing old in Cook County. We'll have our own teen center to hang out in.
Nice.
At the hub. So it's a fine group of people. So,
Thank you. Emergency preparedness.
So we had an opportunity, and Allison made reference to this, to debrief about the holiday storm that we had and our lack of power, and about just directing calls. When should it go to Arrowhead? When should it go to law enforcement? We talked about possibly developing some kind of a list of people that are on medical equipment that requires the use of electricity. And then making sure that we educate those individuals as to how to be prepared for a storm, and also better educate our public about what to do and how to plan for a winter storm. You know, we spent a lot of time and effort preparing people when we had wildfires throughout the county. We need to take that same time and effort and put it into preparing for winter storms. So more to come on that, but it was a really great, very valuable discussion.
Thank you. Healthcare Planning Committee, Commissioner Story.
Thank you. We'll be meeting next month.
Okay. Thank you. And anything from NACO?
Well, we're working on our resolutions to go before the legislature in Washington DC, National Association of Counties. There's over 3,000 counties in the United States. And we go and we talk about resolutions when we have the big national meeting. And it's everything from opioids to mental health to situations with people in prisons and early child care with pregnant mothers, and it's a spectrum of a lot of things. We have to get it down to a manageable size. So that's what we're going to do at the end of this month, because the meeting is in February, so we have to have our ducks in a row. But it's fascinating to hear from different parts of the country what is a priority and what rises to the top. And right now it is mental health care. That's what's rising to the top. So I'll have more in February when we decide on what we're going to present.
Thank you. Northeast Minnesota Office of Job Training, Commissioner Hawkins. Anything there?
My very first meeting didn't meet,
No.
so I'll be meeting in February.
Okay, thank you. North Shore Collaborative, nothing to report there yet for the year. And Public Health Human Services Advisory Council.
We had a great meeting. Alison, of course, did a great job in briefing us on a number of things. We have 2 new members to that board, Dwayne Hazakawa and Jennifer Schultz. So that's helping round out our board, which is great. We, of course, express a lot of thanks to Alison for all the work that is going on and all the trials and tribulations they've had throughout the year. We met just after a very, very cold night in Grand Marais. And one of the things that I brought up and that we asked Alison for more information for at our next meeting is what you're talking about, Ann. What is a preparedness program? Do we have a shelter that we can open for homeless people who really need a space to go when it gets that cold? I think there's a lot of, as I've learned today, a lot of different opportunities and things that happen during these storms, but I don't think there's a high level of awareness for what the options are, or who can help, or what to do. So we asked Alison to have a longer and harder discussion about that coming up at our next meeting. Because when I first came here, I know that we opened the senior center and a couple of other centers if it was really cold and people could go there. I don't think that's happening now anymore. I don't know that, but it's all of those kinds of questions that came up during that meeting that we'd really like to get some answers for and then get some information out to the public, because it's going to happen again. We just know that. And other than that, we're looking forward to this coming year and trying to help support all of the efforts that Alison's group is bringing out and be a little bit more informative to the public as to what's going on. So it was a good meeting. And Dave, you were there. Other things that I might have missed?
Nothing comes to mind, I don't think. Thank you.
Okay.
Re-elected as
Oh, yes, I was
chair.
reelected as
Yes,
chair.
thank you.
We're still trolling for a vice chair. I put the strong arm on several people and got turned down, so
Yeah.
we'll see what happens next month.
I was impressed with people's ability to say no.
I was too. I really didn't expect, I expected someone to cave and nobody did.
Yeah, especially for vice chair, yeah.
I mean,
that's
it's
it,
just not, yeah.
You might just suggest that the vice chair will be chosen from those who don't show up for the next meeting.
Well, we have this rule that you have to be on board of, what, 2
Oh, yeah,
years?
a year.
1 year.
1
Yep.
year in order
Yep.
to join, to do that job. So that took out a couple of people who would have joined.
Yep.
So we might have to have a special election next month. I don't know. We'll check it out. It was a good meeting, though.
Thank you, and moving on for the good of the order. Anything else anyone would like to share? Anything that wasn't covered yet? Else, I'd entertain a motion to adjourn.
I move we adjourn.
Thank you, Rana. Is there support? Thank you, Commissioner Hawkins. We are adjourned.
Thanks, everybody.
This is one of the earliest adjournments. We're just getting so
James?
efficient.
My thing isn't working. It didn't work last time. Oh.